I'd like to review a few different types of safety guards you may find on needles in your time as a nurse. Different safety guards are invented every day, so this is just an example of what you may see. The first one I'd like to go over is a TB syringe. So it has a cap and it has a tube that's over the syringe. So we're going to safely uncap this. And the nice thing about this safety guard is that we can draw up our medication, and then rather than recapping, we can partially deploy the safety guard over the top of the needle. We'd then want to label this, go to the patient's room, and then when we're ready to administer the medication, we simply slide the safety guard back down, and we can then administer our medication. When we're ready to get rid of the needle altogether, then we pull the slide all the way up until it clicks. And the green is over the top of the red. Now, I can't, no matter how hard I try, get the safety guard back down. The needle is now disabled, and it would go in the sharps container. Another safety guard that you may commonly see in insulin needles or TB needles is this type, which is a white lever on the side. To deploy this needle, these needles have caps that have flat tops so that we can use the countertop to safely recap them, but they do require recapping. When we get into the patient's room and administer the medication, when we are done administering, then we simply push the white lever up until it clicks, and then it covers the needle. And now it won't come down, and the needle is disabled. Make sure that you only deploy it after you administer your medications. Some needles have spring systems in them. This one is called Vanish Point. It's a TB needle, and if we look at it very closely, there's a spring up here. I'm going to uncap it, and then we would draw up our medication. We would need to recap this and label it before we went into the patient's room. But then after we administer the medication, we push a little extra hard on the plunger, and the spring deploys and shoots the needle up into the barrel of the syringe so that we no longer have a needle, and it would go into the sharps container. Other types of syringes that are also spring-loaded are medications like this. This is a fragment syringe. So this is a unit dose syringe that it's already been deployed. So the needle would be coming out here, and then after you inject the patient, you pull it out, press a little more firmly on the plunger, it deploys the needle, and the needle pops back up into the plunger here. The last needle guard I'd like to show you is the one we most commonly see on IM needles. So this IM needle is a 23 gauge 1-inch needle. This would be used for an IM injection, and when we take it out of the wrapper here, I've already put it on a syringe, but you can see it has this extra hump on the side here, and this extra hump is where the safety guard is. So to uncap this one, you simply use the flat side and use your thumb to push the cap off, and then you just dump it onto the table. You draw up your medication, and then you would need to recap. So you place the cap onto the table, and you use the scoop method. Line the extra hump there over the safety guard and push down at the hub You always want to recap at the hub or with a table, a hard surface to do it. You never ever want to put your fingers at the pointy end of the needle. I have seen plenty of needles go through their caps and poke the person who's drawing up the medications, or if you recap a dirty needle, you end up getting a dirty needle in your finger. So after you're in the patient's room with your labeled syringe and already did your 3 checks, you can go ahead and remove the cap, administer your IM injection, and then when you're done, you simply flip this up so that it covers the needle. And now it won't come back down. The needle is disabled and it would go into the sharps container.